Ozempic, Wegovy, Manjaro, Zepbound, and now retatrutide. Have you heard of at least one of them before? Yeah, of course. Maybe you don't know of retatrutide yet, but you will if you stay tuned. And maybe you didn't know that Ozempic, Wegovy, and semaglutide are all the same medication. They are all single mechanism GLP-1 agonists. We're going to focus on the main players. And that Zepbound, Manjaro, and tirzepatide, also the same medication, two mechanisms, GLP-1 and GIP medications. So, do you know how they work? Do you even know what the acronym GLP-1 is? Most people know they decrease your appetite, and most people don't know what GLP-1 actually is. You know you lose your appetite. Okay, you're not wrong, but that's like saying a car works because you push the pedal. It's the thing that you can see. It's not what's actually going on under the hood. And it's crazy because people are buying this stuff online, sticking it in their body every week, some with a doctor and plenty without. And they could not tell you the first thing about what's actually going on in their own body. They just know the scale goes down. I'm not even kidding. I think every week I get told of a friend or someone they know who is getting it online asking me what I think. I'm sorry, but that's wild to me. If I'm putting something in my body, I want to know exactly what it is and what it's doing to my body, and maybe find a qualified resource. If I asked you right now, not what does it do, but how, could you explain it? Or do you just know it works? If it's that second one, then you got to stay with me because by the end of this, you're not just going to get it. I hope you are the person at dinner who explains it to everyone else. So I'm Dr. Michelle Gilliatte, double board certified in family and obesity medicine, founder of Somavi Wellness Center and Med Spa at Keystone at the Crossing right here in Indianapolis. This is the Vital Link, and this is the series, The Skinny on the Shot. So here's the big idea for today. This drug is not doing anything foreign to your body. It's not some alien chemical forcing your body to do something weird. It's taking control of the system you were already born with and turning the volume way up. That's it. That's the whole secret. So let's start with the star of the show, GLP-1, glucagon-like peptide 1. It's a hormone. It's a peptide. Peptides are a huge hot topic these days, and so we'll talk more on peptides after this series. So GLP-1s, lock this in first. Your body already makes it. You're making it right now. Not a foreign drug, a natural gut hormone. Cells in your small intestine release it every time you eat, and it does 4 jobs. Insulin first, because that's the one everyone gets twisted. So, job 1, it tells your pancreas to release more insulin. 2 different things happen with insulin: how much you have and how well it works. Not the same thing. And GLP-1 only does the first. It tells your pancreas, put out more supply. It does not reach into your cells and make them respond better. That's insulin sensitivity, totally separate mechanism. And here's the genius. GLP-1 only releases that insulin when your blood sugar rises. High after a meal, release. Normal or low, kind of goes quiet. That's why it almost never drops you into that dangerous low, unlike the old drugs that force insulin out no matter what. It's self-regulating. It's super smart. Job 2, it quiets your liver. Your liver makes its own sugar. It's called gluconeogenesis. Your liver literally manufactures glucose or sugar and releases it into your blood. Useful when you're fasting, but in diabetes, the liver gets stuck doing it even when your blood sugar is already high, dumping more sugar into a pile that's already too big. GLP-1 reins that in directly by lowering glucagon, another hormone, but this one tells your liver, release sugar, and GLP-1, as we said before, raise insulin levels, which tells your liver, stop, we've got enough. Turn one signal down and the other up, and your liver finally quits dumping sugar you don't need. So number 3, it slows your stomach. So food sits longer and you stay full. Most people know of this one. Number 4, the big one, it talks straight to your brain, to the appetite center, and says, enough. Now here's the question that trips everybody up. I just told you GLP-1 adds more insulin. It doesn't make your insulin work better. So, how does it fix insulin resistance? Because we already know, or maybe you don't, more insulin isn't the answer. Look at diabetic patients on insulin. They need more, then more, then more. The doses keep climbing. So, if just adding insulin worked, that would have solved it years ago. Clearly, something different is going on here. So, what is it? Insulin is like the delivery driver. Its whole job is to pull up to your cells, drop off sugar for energy. Simple. Now picture deep belly fat as a house with the driveway totally blocked, junk piled everywhere. The driver pulls up, can't even reach the door. He's calling, nobody answers. That's insulin resistance. The insulin's right there in the house. The delivery just can't get through to the owner. And here's the kicker. The fat isn't sitting there quietly. It's actively throwing more junk into the driveway, pumping out inflammation, blocking its own door all day long. So what does your body do? It panics and it sends more trucks, more insulin. That's the diabetic on a climbing insulin dose. More and more drivers, all stuck in the same blocked driveway. So you can manage the sugar that way for a while. You have so much insulin, you overcome the junk that's blocking, but you never fix anything. The path is still blocked. Fat is still filling the driveway back up. GLP-1 does the opposite. It doesn't send more trucks, it clears the pathway. Remember jobs 3 and 4? It kills your appetite and quiets the food noise, so you eat less, and the weight starts coming off due to decreased caloric intake. And as that deep belly fat melts away, the junk clears out. Same driver, same insulin, same amount, but now he pulls up right up to the door and drops off the package. Easy. Nothing changed about the driver. You just cleared the path. So the fat was the blocker the whole time. That's how GLP-1 fixes resistance, not by adding more insulin. That only babysits your sugar for the day. It gets the fat out of the way that was jamming everything up. And the liver fat goes first on these drugs, which is awesome, which is exactly why blood sugar starts improving so fast, sometimes before the scale even moves. And I've seen this many times. I've had patients whose A1C improves vastly before they even start losing weight. And then the weight usually follows after that with good habits. Okay, so now here's where it gets good, because GLP-1 is not working alone. It never was. Our bodies are 360 degrees. It all works together. Your body has a whole crew of hunger hormones, a built-in control panel you've had since the day you were born. And the shot is just turning the dials on a system that's already running. Let me introduce you to the crew. All right, first we have ghrelin. This is the troublemaker. Ghrelin is your hunger hormone, the only one that says eat. It's made mostly in your stomach, and when your stomach's empty, ghrelin rises and screams at your brain and says, feed me, feed me. That growl, that 11 a.m., I need a snack itch, that's ghrelin talking. It goes up before meals and drops after you eat. It's the gas pedal. So now the brakes. You've got 3. You've got CCK, cholecystokinin, comes out of your upper gut the second fat and protein hit it. It's the fast one, the first responder. It says, start wrapping up, we're eating. You've got GLP-1, which we talked about, and PYY. Comes out lower down in your gut, and it's the long hauler. It's what keeps you satisfied for hours after a meal, so you're not raiding the pantry at 3 p.m. So look at the whole dashboard. You've got ghrelin, the gas, go eat. CCK, GLP-1, and PYY are the brakes. Okay, stop, you're good. And every meal of your life, this crew is firing back and forth, keeping you in balance. You never think about it, it just runs. So here's the question that should be going off in your head right now. If your body already makes all of this, why doesn't it just work? Why is anybody even overweight at all? Because for a lot of people, the dashboard is broken. The brakes got weak, the signals went quiet, too much processed food, too little sleep, too much stress, years of yo-yo dieting that cranked up ghrelin and the brakes down, your gas pedal's stuck and your brakes are mushy, and then everyone has the nerve to call that a willpower problem. It was never willpower. It was a broken signal. I'm telling you this right now. And that's what the drug does. It doesn't give you something you never had. It just wakes up that control panel and slams the brake pedal back down hard. GLP-1 floods the system. The fullness signals get loud again, and for the first time in years, your brain actually hears enough. That's the food noise going quiet. That's not magic. That's your own system finally working in a way that it was built to. So here's what I really want you to walk out of here with. That syringe isn't a stimulant. It isn't starvation. It isn't some foreign chemical hijacking your body. It's a louder copy of a hormone you've been making your entire life, turning up a system that got turned down. And that reframe, I hope, changes everything. Because for years, we told people your weight was a willpower problem. Just eat less, just try harder. My obese patients try hard all the time. I mean, they do not lack willpower. I promise you that. And they are some of the hardest working patients that I have. So just eat less, just try harder, close your mouth. We made it a character flaw. It was never a character flaw. It was a broken signal. And you don't fix a broken signal with shame. You fix it by turning it back on. So you're not overriding your body with this drug. You're not cheating. You're giving the body its own voice back. Remember I've told you I've taken this drug myself, microdose, an itty bitty dose. I've tried every single diet out there, every one. I've been up, I've been down, I've had twins, I've been thin, I've done fitness competitions. I've starved myself down to stage lean, eating exact macros at exact times of the day, weighing everything, the whole machine. I've read a million diet books. I even use these tools on my clients: keto, low carb, paleo, OMAD, all of it. With my own patients, short term, because they do work short term. But here's the kicker: the dieting was never the hard part. Maintenance is the hard part. And I was never carrying 100 pounds. I was uncomfortable, not obese. But I know exactly what it is to fight your own body every single day and call it discipline. And this is the first time that I can go out to dinner with my husband and just enjoy it. Be a little mindful, sure, but not white knuckling a list of parameters that, quite frankly, no human being can hold forever. Have a bite of a dessert or two, or maybe even three, but that's it. That's what got me. Not the scale, the freedom. The edge came off the food noise. And for the first time, I wasn't doing math at a table. How many calories, how many macros? And that's what tells me this was never about willpower. I can dedicate and be fitness stage ready, not a problem. I had discipline in spades. What I didn't have was a signal that worked, that just turned back up. So now you can answer the question: what's it doing in there? It's turning up a control system you were born with, quieting the gas, slamming the brakes, clearing the fat that was blocking your insulin so your own body works again. That's the foundation. Dosing, side effects, protecting your muscle, how to come off of it the right way. All of it makes more sense now that you know the machinery. But knowing how it works and having it managed the right way are two different things. So if you're on a GLP-1 and you want somebody to manage it, call us. We'll put you with one of our providers. We do monthly weight loss GLP-1 management, so you've got someone guiding you appropriately and keeping you safe the whole way. I'm Dr. Michelle Gilliatte. This is The Vital Link, and this is a series, The Skinny on the Shot. We'll see you in the next episode.